All right. Well, welcome to our Impact Health educational webinar. My name is Lauren McQueen. I heard all of your introductions, so I'll introduce myself here in a little bit. I live right outside of Austin, Texas, in the beautiful Hill Country. For those of you that don't know what Impact Health Sharing is, or maybe you're not even familiar with health sharing in general, Impact Health is a nonprofit alternative to traditional health insurance. And let me tell you, we are disrupting what I believe is a very, very broken health insurance industry. Raise your hand if you agree with me that the health care system in America has a lot of issues right now. Right. And what we have our hands on with Impact Health, we, like I said, are making a huge difference, and pun intended, a huge impact within the healthcare community around the country. And so your special treat for today is you could have not chose a better webinar to be on, because this week we are having today the CEO and founder of Impact Health, Mr. Phil Chrysler, who's going to come on here in about 30 minutes and talk to you about the vision of Impact and answer questions that you have and go dive into some specifics, maybe even talk about some exciting new things that are getting released very, very soon. And so with that said, you guys, I'm a big believer in Impact Health. Prior to Impact, as a self-employed individual, I had no healthcare coverage. If you're a business owner or you're self-employed on here, you're probably in agreement with you either have no type of healthcare or you're paying way too much money out of pocket for healthcare. And so I know every single week we have, business owners, self-employed people, doctors come on here to see how can they partner with what we're doing with Impact Health, or just everyday average people looking to learn about Impact to see if this is a good plan for you or not. Before we get started on that, let me just say that at the end of this call, we're going to be opening up to some Q&A for you guys to ask your questions. And nobody better to answer them than from the CEO and founder himself. Come and join our Impact Health community Facebook page. It's called Health Sharing Crusade Community. You can scan the QR code. We post phenomenal testimonies. Matter of fact, we literally posted a testimony in there today. You can see it when you go in there. It's going to blow your mind, but anyone is welcome to join this group. But let's talk about healthcare in general. So we already all agree, right? 312 of us, that there's a lot of issues in the healthcare system right now. And one of them is how it's becoming unaffordable for Americans to pay for, because the average individual in America paid $780 per month, and the average family paid $2,000 per month for marketplace health insurance in 2022. In 2019, 59% of bankruptcies cited medical expenses as a major factor. And so 80% of our country are trying to lower their healthcare costs. 5% of the entire population, 5%, is responsible for 50% or more of the annual healthcare spending costs. Let that sink in. This means, of course, the majority of people are overpaying for their healthcare costs every month. And 87% of Americans do not reach their deductibles each year. 87% of people who have health insurance do not reach their deductibles each year. Over 100 million Americans are in some sort of healthcare debt right now. So what are people looking for? They want to be able to afford health insurance and have it be good coverage, right? They're looking for affordable monthly premiums. They're looking for affordable copays, affordable deductibles. They want to be able to pick their doctors, pick their facilities, not be confined within a network of doctors. And employers want to be able to offer healthcare to their employees. My husband, I didn't mention this, he's a business owner. He co-owns Priority Roofing. They have a handful of W-2 employees. They have hundreds of 1099 employees. Prior to Impact, their W-2 employees had no type of healthcare benefits. Now they're offering and covering their W-2 employees with Impact Health, and they have shared this amazing healthcare program with their 1099 employees, and many of them who are getting up on roofs every day are taking advantage of the affordable healthcare through Impact Health. And so let's talk about health sharing programs in general. I know many of you on here are probably familiar with traditional health insurance, but health sharing may be a new concept to you. It's not a new concept in general, because it's been around for over 40 years. Now, health sharing originated actually in churches. 40 years ago where church members would pay each other's medical bills. And so the way that Impact works, it still shares that same health share concept, where every month that you're paying your Impact membership, you're paying into a pool and everyone else is paying into that pool. And when a medical need or a medical expense comes up, through an AI technology, those funds in that pool get reallocated to pay for someone else's medical expense or someone else paying for your medical expense. And so it's phenomenal. There's so many benefits to it. Many of you are probably familiar with some of the other health sharing companies out there, MediShare, Christian Health Ministries, Samaritan, all great companies. Impact is just a little bit different, where it feels more like traditional insurance. And you're going to learn a little bit more about what that means here in a little bit. But some major benefits of Impact Health, we're helping individuals, families, small businesses save anywhere from 30 to 50%. We also offer negotiated rates for pharmacy and medical services. So with some other health share programs, the member is responsible for negotiating their medical bill on their own behalf. But instead, that provider, whether it's a doctor or someone at urgent care or the hospital, they're going to bill Impact directly, and Impact is actually going to negotiate that bill for you on your behalf, where on average, they're negotiating bills down by 72%. I have a personal testimony of that. I can attest to it. It's phenomenal. So why Impact? Well, Impact offers comprehensive medical care. With Impact, you have freedom, medical freedom. Doesn't that just have a good ring to it? Medical freedom to pick your doctor and pick your facility. You have nationwide access to all networks. You're not confined in a specific network. What that tells me is you can get the best possible care for you and your family with the best possible doctors around the country. We offer unlimited telemedicine or telehealth, where if you don't want to go into a physical doctor's office, but you want to get the medical attention you need out of the comfort of your own home, you can have an appointment virtually with a doctor, and it's completely free 24/7. Amazing RX prescription pricing. About 90% of the time, we are cheaper than GoodRx Gold. We have pricing, get this, starting at $73 for individuals, $378 for families of 3 more. Household PRAs. What do I mean by PRA? PRA stands for primary responsibility amount. In traditional insurance, that would be known as a deductible. So instead of having an individual per person deductible, we have a household deductible, a household PRA as low as $2,500 for the year, where all the medical bills for the whole family goes towards reaching that one household PRA. It's privatized. Impact is a privatized healthcare group. Like I said, it is a not-for-profit. This gives us many, many, many benefits to what traditional health insurance cannot do. And then available for migrants, as long as someone has an ITIN number and then a legal form of ID from either Mexico, Guatemala, Canada, or the US, they're able to become Impact members as well. And so who is our target customer base? Our target customer base is individuals and families who are overall fairly healthy, who are currently paying some or all of their healthcare costs. And 91 million people fall into these 3 categories. Non-group companies, so these are small businesses with 49 employees or less, those that are self-employed like myself, independent contractors, gig or part-time workers, those that are underinsured, and then of course, those like I was prior to Impact that have no insurance at all. And so a common question I get is, Lauren, tell me about pre-existing conditions. Well, I just want to point out that no matter what pre-existing condition you have, nothing will disqualify you from becoming an Impact member. And your pre-existing conditions, get this, they don't dictate your monthly payment. It's not like a higher monthly payment because you have a lot of medical conditions. So anybody can be an Impact member, regardless if you have pre-existing conditions or not. Here is our definition of a pre-existing condition. Pre-existing medical conditions are in which known signs, symptoms, testing, diagnosis, treatment, or use of medication occurred within 36 months prior to being an Impact member based on someone's medical records. So once you have been sign, symptoms, treatment, diagnosis free for 36 months, that's not considered a pre-existing condition. And so pre-existing conditions, Understand this, when you have a bill associated with a pre-existing condition, Impact is still going to negotiate and reprice that bill on your behalf. Remember, I said on average, Impact is negotiating and repricing bills by 72%. So you're going to get to take advantage of that pre-existing condition bill, get repriced. However, that repriced amount is just not going to go towards reaching your PRA or your deductible. Okay. So again, anybody can be an Impact member. You don't get disqualified for having a pre-existing condition. It's just not going to count towards your PRA. Now, high blood pressure and high cholesterol will not be considered pre-existing condition for purposes of determining eligibility for future vascular or cardiac events. So let me give you a quick example before I turn the call over. I want to show you what our reference-based repricing. When I talk about how Impact negotiates the bill, it's called reference-based repricing. This was an employee of my husband's. He had blood clots in his legs, went to a hospital right outside of Denver, Colorado. His hospital bill was $5,751. Impact repriced it, took off, and negotiated down $5,130. All this gentleman was responsible for was $620.53. Now, this was a pre-existing condition, so this did not count towards reaching his PRA. Had it not been, then of course it would go towards reaching his PRA. But look how much money he saved, even though this was a pre-existing condition. I'm going to turn the call over to my co-host, and then you're going to hear from the CEO and the founder of Impact Health. But I cannot wait for you guys to hear from this next gentleman. He's a wealth of knowledge. He's helped thousands of people by now with Impact Health sharing. He is a personal mentor of mine. And so with that said, I'm going to pass the call over to our Regional Vice President Platinum, Mr. Jeff Street.
Well, Lauren, thank you so much. And what an amazing job that you did here today. How many of us can just hear Lauren's passion and feel Lauren's passion when it comes to, really being a crusader, disrupting what many of us believe is a broken industry here with our marketing partner, with our company that we represent, Impact Health Sharing. So amazing job, Lauren. And, so excited to get a chance to, share some information with you here today. And, it's an exciting time when it comes to, what's happening in the Impact Health Sharing community. Just over a month ago, Impact, it was in Yahoo Finance, says that Impact Health Sharing surpasses $15 million in payments of members' eligible medical bills. We continue to experience double-digit membership growth month after month. For our nonprofit organization. New members in February were 61% above what they were February from the year before. And I love what it says on the bottom. Unlike insurance, there's no incentive to not pay a medical bill. And I love being part of this community that's really put together for each of us to support each other as members of the community to pay each other's medical bills. And when it comes to getting a quote and when it comes to pricing, it's very simple to see what a quote would look like for you, for your family, or for your small business. So whoever invited you onto the call, they're a referral partner with Impact Health Sharing, and they are part of Impact's marketing partner, where they have their own website, their own affiliate link where they can send to you. And it's very simple for you to be able to get a quote. Looking at that website, all that you're going to need is the date of birth of the oldest person in the family, how many members are in the family, and then you're going to get a result immediately. So in this particular quote that I'm showing you guys right here, this is for a family of 3+, actually a family of 5, where the oldest person in the family has a 1969 date of birth. So all they do is they just put that information in, they hit get quote, and then a quote gets generated for that particular family. Now let's look at this particular family's quote. On every quote for anybody that's under the age of 65, there's going to be 4 different options. The same 4 options for all the quotes that get generated. The only thing different on the quotes is the primary responsibility amount and the standard rate. Now, again, primary responsibility amount, those words are synonymous with combined family deductible. And then the standard rate, that's synonymous with your monthly premium. So every quote is going to give 4 different primary responsibility amount options: a $2,500, a $5,000, a $7,500, and a $10,000 option. Now, the lower the PRA, the higher the standard rate is going to be. The higher the PRA, the lower the standard rate's going to be. So you see for this family, if they chose the $2,500 PRA, their standard monthly rate would be $628 a month. On the $10,000 PRA, their standard rate would be $456 a month. Now let's dive in a little bit deeper. So that the family is going to meet their PRA, their primary responsibility amount. And once they meet that PRA, then there's what's called a 10% co-share. Now, in the insurance world, typically when somebody hits their deductible, many times there's an 80-20 split. And what that means is after that individual or a family hits their deductible, the insurance company will cover 80% of their medical bills, and the insured person is responsible for 20%. That's not the case here with Impact. Once that family meets their PRA, then the community shares into 90% of all eligible medical bills, and that family is only responsible for 10%. That's called the co-share. Now, the most a family could ever pay, think about it like a max out-of-pocket expense. The most that a family could ever pay in their 10% co-share is $5,000 a year for the family. Once that family has met that 10% co-share, at that point, Impact will share in 100% of all eligible medical bills for that family. So again, you can kind of get a chance to see what the quote looks like for that family. Here's actually a live demo on one of our referral partner sites that I'll show you, just to go through and just give you a couple different examples. This is actually the Texas Chiropractic Association sites. They're one of our leading referral partners that I've worked with closely. So let's just say somebody's a little bit younger. So January 21st, let's say 89. For their date of birth. And let's say it's just one individual. I go and I click on Get Quote, and there's the quote for that individual, anywhere from $102 a month to $246. For that same individual, now let's make them a family of 2. I click on Get Quote, and it changes the quote for that family of 2. So again, you can see how quickly somebody can get a quote generated. If somebody likes what they see and they decide to enroll, they simply scroll up to the referral partner's website, click on Enroll Now, and it takes about 15 minutes to enroll. And somebody's membership will begin the first day of the next month. So anybody that's looking to be an active Impact member for June 1st, you would just need to complete your enrollment by 6 o'clock East Coast time on Friday, May 31st, and then your Impact membership will be in effect on June 1st, which is great. There's no such thing as open enrollment with Impact. Somebody can become a member at any time, and their coverage begins the first day of the next calendar month. Now, let's say somebody has some specific questions after they get their quote. They can literally just submit themselves in as a lead, put their name, email, and phone number right here, click on Learn More, and here's what's going to happen. They're going to get a text message and an email from Impact Health Sharing to schedule a call to speak to somebody that'll answer any of the questions they have, and if they like what they hear, they'll be redirected to enroll on that referral partner's website. Now, let's dive into this a little bit more. How about for individuals that are over 65? Well, we also have a program for seniors. This is something that can replace a senior's supplemental plan as long as they have Medicare Part A and Part B. So for seniors that have Medicare Part A and Part B, they can enroll for Impact for Seniors. The price is going to range anywhere from $96 a month to $140 a month based on the age of that senior. And then anything that Medicare Part A and Part B does not cover, Impact for Seniors is going to pick up the rest. Now, typically, folks that have Medicare Part A and Part B. Sometimes they might also have Medicare Part D. That's for their prescriptions. So if they have Medicare Part D, Impact will also share in their prescriptions on whatever Medicare does not cover as well. Now, remember, with seniors, there is no pre-existing conditions with seniors. So anybody that's over 65, no matter what they've gone through, again, Impact is going to share in anything that Medicare Part A and Part B does not cover. Now, some of the things that really separates Impact is Impact feels like traditional insurance, even though it's not all insurance. It's that nonprofit alternative approach. And you're going to see what I mean by that in just a minute. But what really separates Impact is how they manage their billing and also their reference-based repricing that you're going to see here today. Now, going to the doctors on Impact, this is what your member card looks like. So you can see it looks very similar to an insurance card, where when somebody goes to the doctors using Impact, they just present this card when they get to the hospital or they get to the doctors. Now, all of our members get a free annual wellness visit or physical for every member of the family. They also get a $150 blood work credit for every member of the family. They get 50 outpatient therapy visits per year, which includes chiropractic, outpatient therapy, respiratory therapy, where they are not subject to a provider fee, which is like a copay. So you'll hear from our CEO in a few minutes, but Impact is very focused on having members not just be healthy members when they get into our plan, but stay healthy members as they're part of our community. And so you'll see they're rewarding people for making healthy lifestyle decisions. Impact also has 24/7 free unlimited telemedicine with their MD Live program. An office visit after that annual wellness visit would be $50. You can see ER and inpatient is $150 and so on. But Impact's invested the money to be in all the clearinghouses in the country where they have an EDI payer ID number that you can see on the back of the Impact membership card. And this is very important because this really makes Impact stand out in our very good health sharing community with our other brother and sister companies in this industry. See, previously in health sharing, when a member would go to the hospital or would go to the doctors, it was normal for that member to have to pay up front as a cash pay discount and then submit their medical bills to their health sharing company, and then they'd wait to get reimbursed by their sharing company. And this could be a cumbersome process for many people and sometimes took a long time. And so what's great about the way that Impact architected this platform is when a member gives that card and that payer ID number gets inputted in the billing system, that provider can bill Impact directly. And Impact is paying our providers faster, and in many cases more than they're getting paid by the insurance companies. Matter of fact, last month, you'll see Impact was processing and paying medical bills in under 17 days' time. So this is something that's very provider friendly. Now, if for any reason a provider refuses to bill Impact when you go and use your Impact member ID card, if for any reason that happens, you see there's a provider support line on the top of that card right above the payer ID number. This is called provider pushback, and sometimes this is going to happen. So you want to just make sure that provider calls that number once they hear how quickly Impact pays and how much they pay. Typically, that provider will be really excited about working with Impact. And if for any reason they still decide to not bill Impact electronically, then in that case, you can be treated just like a normal health sharing member, where you can just, worst case scenario, you can say, hey, listen, just bill me at that cash pay discount. You can pay that cash pay discount price, and then you can submit that medical bill in your member center to Impact. If you've already met your PRA, Impact is going to reimburse you as a member as quickly as they're paying their provider. And if you haven't hit that PRA yet, whatever you paid will just be applied to your PRA. Now, let's talk about that reference-based repricing. Here's a couple of examples. Lauren talked about how her husband owns a roofing company, and a scary statistic in the United States is over 26 million Americans have no health form of healthcare coverage because they can't afford it. And Lauren's husband, one of his employees fell into this category where previously she couldn't afford healthcare coverage. She was opting out of healthcare because she couldn't afford the cost. Once her company started offering Impact as an option for their employees, she saw a price for herself for $150 a month, and she opted in. Shortly afterwards, there was an unfortunate incident, and she shattered her leg, had a significant fracture of her leg, went to the hospital. That medical bill came out at $200,000. Now, look at how the repricing model works. See, that bill got sent to Impact electronically. Impact said that's not fair market value. They negotiated that $200,000 medical bill to $20,172. Now, this particular member had a $5,000 PRA, and so she was responsible for the $5,000 and the 10% co-share. What she was left with was $6,517, and you can see how the community shared in $13,655 of her medical bill. Now think about this. This was somebody that previously had no health care coverage. If this same incident had happened a year ago, she would have been responsible personally for trying to negotiate this bill with the hospital, and who knows, might even had to possibly declare bankruptcy because of the size of the medical bill. I love being part of a community that shares in each other's medical bills. See, when I used to pay my bill to my former health insurance company and I paid that bill, I never knew where my money went. This last example I'm going to show you is a personal friend of mine that I personally introduced to the Impact community. This is actually from the Beck household. So just remember this name. So this individual, a friend of mine, became an Impact member, ended up literally saving over $20,000 a year by becoming an Impact member, which is incredible. The savings is incredible. But here's him actually using it. See, his wife had a battle where they thought that she potentially had cancer and had procedure after procedure after procedure. In this one particular medical bill, that he had sent me a copy of it and just asked me to actually use this as an example for people. This medical bill came out at $37,659. This member had already met their PRA. So they had the PRA met. All they were responsible for was that 10% co-share, $1,401.51. And the community shared in $12,613. Now, here's what's special to me about this. I was one of the members that my account was matched to actually pay this medical bill. And this is actually my friend. This is somebody that I talked to about Impact Health sharing personally, and just the feeling that I have knowing that part of my monthly standard rate actually went towards helping my friend's wife in this battle that she had. By the way, she's cancer-free now, which is very exciting. But this is the testimonial that Rick sent to me. Good morning and happy Sunday. Was just in my Impact portal and wanted to share this screenshot. The power of what we have our hands on. I was once skeptical because we all know it sounds too good to be true. But Impact is truly a blessing to my family. This is one of several from my wife, Michelle's surgery, but to date, the biggest bill yet. Now, we also do offer Impact for businesses. Our target market is businesses with 49 employees and less. But the last thing that I want to show you guys, and then we're going to get a chance to hear from our special guest, CEO Phil Chrysler, is I want to show you the Impact Member Center because this is what makes Impact industry leading, most transparent, best in class, where they have the most transparent technology platform that's ever been seen in this industry. Now, when you go to impacthealthsharing.com, you can simply click on member login, and you can actually, once you're a member, you log in your member center right here. So I've just already logged into my own personal Impact Member Center. So this is me as an Impact member, and you can see right when I log in, remember, we're a nonprofit. So I love the philanthropic piece of people praying for each other. Look, this individual lost their job. They were asking for prayer, and we see in this economy, unfortunately, this is happening more and more frequently. But so you see prayer requests. Also, you can see anytime that you're matched to pay a member's medical bill, you have your own decentralized reserves. See, all of our impact members have their own actual impact accounts. So here's my account personally, my dashboard, and you'll be able to see what I have currently just sitting in my member share account. Right now, I have $1,400 in my member account, and you can see where all the money moves. You can see the families that I've recently helped, that I was assigned to, and all this is done electronically through the magic and technology and through an algorithm where members are just matched and the money just goes from one account to the other. You don't have to do anything manual at all. It's all through technology. And as you can see the list of the families that I've recently helped, my wife and I, you can see that the Bayek household is one of those names listed. Again, that's my personal friend. Now, you can see what goes towards the admin fee, what goes towards program fees, what goes towards administrative fees, what goes towards the sharing community. I love that it's 100% transparent, and you can see what's actually happening in the community as a whole. You can see what were the largest share amounts last month. See, the community paid $76,500 for the Walker household. Our community paid $48,300 last month for the Pacheco household, and so on. You can see how fast those medical bills were processed. You can see how much money in medical bills were paid last month. You can see what's happening in the community. And I just love this transparency. And then look at the prescription piece that Lauren talked about. See, Impact has the best wholesale prescription pricing in the industry, and our member portal for prescriptions competes all the local pharmacies against each other. So we as members can always make sure we're going to the pharmacy that's going to give us the lowest rate for the prescription that we're looking to go out and get. Now, I just did a little search on my portal for Rosa. I don't even know how to pronounce this, but some kind of calcium that somebody had actually just asked me about the other day. And you can see how if I go to, we can switch this quantity from 15 days to 30, and you can see what the price is. You can see if I went to Tom Thumb, it's $269 for a 30-day supply. Long Perry, $294. Now, I don't think anybody's going to drive an extra mile for a 30-something cent savings, but I've seen some prescriptions where it was literally 30, 40, 50, even $100 less in one example, whether it was CVS or Walmart. And just for members knowing the right place to go, this is incredible. Now, for those of you that want to learn more about the business opportunity here that you're wondering, you keep saying referral partner. Is there an opportunity here as well? The answer is yes. We're not going to cover that today. But for those of you that want to learn more about being a referral partner with Impact's marketing partner and earning residual income by referring Impact to individuals, families, and small businesses that you know, make sure you get back to the person that invited you on the call and ask them, how do I learn more about the business opportunity? But we're so excited because today we have the CEO of Impact, Mr. Phil Chrysler. And I got to tell you, I've done this presentation a lot of times. Today was probably the first time that I've ever felt nervous doing this presentation, just because I know that there's a man on this call listening that truly has made an impact on so many lives, including mine, including my family. So, Mr. Phil Chrysler, thank you so much for being on our call here today. And I know that you've got a message that you want to share for 420 people that are on here today. And you can just see people's excitement about finding out a better way, an alternative for this high cost of healthcare. Thanks so much for being on our call today.
Wow, fantastic. I'm so proud of your presentation. You and Lauren have just done a terrific job of unpacking the undeniable value proposition in what we put in our members' hands, right? And from a transparency, from an information standpoint, it's just never been done in our industry. And you guys really did a great job. I've been on a lot of these presentations where I've listened in, and certainly I would rank your combination, you and Lauren, as one of the best presenters of Impact Health Sharing. So I thank you for that, and I really appreciate that. And the audience should give both of you a terrific clap right now. So that was wonderful. Thank you. And yes, we are disrupting healthcare because it needs it, right? We got into healthcare simply as a way to help our growing membership find a better way to reduce costs and a better way to serve them in their most hour of need. And we couldn't find a traditional path with health insurance to do that. We did find a way with healthcare sharing. And what we did is we partnered with a terrific group of people that had done exactly what we're trying to do, only they did it the hard way. They had scaled a very good Christian-based healthcare sharing organization that still exists today, leads the industry in many ways, good organization. They serve their community and their members very, very well. But after, these guys and team of people, they went from around 7,000 households, kind of where we are right now. We're around 7,500 households, 13,000 plus members. And then 5 years later, they ended up around 135,000 households with several 100,000 total members. And they did it with very little transparency, very little technology, and really no automation. I remember the stories of them having rooms of paper applications stacked 6, 8 feet high in multiple stacks in rooms that order entry had to enter, right? And now here we are, after they had left that organization, they got together and said, wow, there's a better way to practice healthcare sharing. We need to usher in this contemporary version. We need to leverage technology. We need to leverage community, right? We need to leverage automation. And so when they presented their platform, I became their very first customer. I said, that is healthcare sharing I want to be involved with. I want to lead the industry in ushering in this new era of contemporary modern version of healthcare sharing, where the provider can see all they need to see, where the member and potential member can see everything that should give them some comfort or alarm, depending on how that healthcare sharing organization is performing. And so we did that, in January 2020. Welcome to COVID, right? We launched Impact Health Sharing. Every month we grew. Some months it was only by 40 or 50 households, but we were growing every month, and we were getting better as an organization. We're introducing processes that were very member-centric, that improved things, that just added value to our members. And here we are from January 2020, now 4.5 years later. We've been in the healthcare sharing industry and leading it in many, many ways with this platform and other things. And here we are sitting as an organization. I remember talking to my friends that helped us start Impact Health Sharing, and they said, okay, hey, what you want for reserves, what you want in member-owned accounts is about 90 days, 120 days, 3 to 4 months additional. If you can achieve that, then you're going to be in a very, very good place, because that will be industry leading as far as healthcare sharing distributed reserves. And that should give you comfort, right? That was our goal, is to put Impact in that position. Well, we actually surpassed that position. We've actually more than doubled that position. And so the fun opportunity that we've had over this last, year, 2 years, as through our new marketing partner just over 2 years ago that joined us, that Jeff referred to. And so there's a really exciting referral process to this. So I really strongly encourage all of you, if you want to learn how to earn additional dollars while helping members, friends, family, business associates save money and become part of a community that provides and values transparency and honesty and integrity, then you're going to certainly want to pay attention to that aspect. But yeah, so we have been, it's been fun, looking for ways to give back to our members, right? And Lauren and Jeff both talked about this as a not-for-profit, right? I don't have those capitalistic tugs that the for-profit entities have, right? I don't have shareholders demanding that we return at the ultimate, whatever cost, value back to them, right? And I'm not knocking that system. That's capitalism, and it's alive and well, and I'm thankful for it. But I just happen to believe in healthcare. It should have a not-for-profit approach. That way we have no incentive not to pay medical bills. We have no incentive other than to serve our members. And that's what we are organized and tasked to do as a healthcare sharing organization per our guidelines, right? So we publish these guidelines so you as a member and as a potential member can see what the community will participate in eligible medical expenses. And if you have questions on that, you can certainly talk to the person that invited you, or you can call us. Whether you're a potential member or not, we will give you those answers. We want Impact to be a great fit for you because, again, we have no other motivations other than to align ourselves with members that see it like we see it and that want to maintain this healthy lifestyle or try to get healthier, right? And so we're an open book that way. And so we're very, very proud of that. But now, as I talked about a little bit, we're in this position, 4.5 years later, we've now processed over 115,000 medical bills and counting. Just last year alone was over 42,000 medical bills. So you really see the uptick, the growth that we're on, right? It is double digits every month as compared to the previous month of the previous year. And so very, very excited about that. And so now we look for ways where we have these 8-10 months in reserves where we say, okay, how can we best invest into our membership more? What can we do to add more value? And so we're going to be talking about those specific ways, certainly in the coming weeks. There's an event in June where we're really going to kick off this kind of specific announcement of what we're going to do. But I can tell you, if you like to see and smile, and you'll be glad with one of the new enhancements that's coming your way at no additional charge for Impact members. The other way we're gonna do will be industry leading, never been done before in our industry. We've looked at ways where we can incentivize our members to do good things, to do preventative, healthy things. And we've come up with a broad list of categories that say, if you participate in any of these activities, any of these actions, we're going to give you an incentive to say, way to go, good job, because we know you are investing in a healthier you, which ultimately provides a healthier community, which ultimately keeps costs down. That's one of the things that we have never done at Impact is have a across the board price increase. We just haven't needed to, right? There's been some age bands where as you age up, there's been a slight increase, but we have never, ever had a across the board X amount of percentage price increase. We haven't needed it. We've been able to manage our costs well. We've been able to pay our bills. As Jeff talked about, right? We're paying providers right now in about 12-15 business days. So we're building this reputation in the provider community that our providers are saying, wow, I'm getting paid by Impact. Even by the time the good old United States Postal Service delivers that check, it's within 30 days. And so we're paying them at fair market value prices. And we're doing that for a number of reasons. One, because we want our member to be seen as a good paying customer to their provider. We also do that for the Impact brand and the value that it brings. We have one very well-known national provider says, I don't take healthcare sharing unless it's Impact Health Sharing, because we've established that track record of paying them at fair market value prices in a very, very quick fashion. So they know us now. And so we're building that over and over throughout this great land, that reputation. And we hope by doing that too, it lifts up the healthcare sharing community as an industry. And so, we're very, very excited about that track record, and that'll continue. Our billing team does such a terrific job. But I say all that to say all the levers that we're doing, all the enhancements that are coming are because we're member centric, because we're not for profit, because we are performing well, both on an operational standpoint, and that's because of a great team of people that not only is capable, but they also care a great deal above normal. And then also through our marketing partner efforts, we continue to grow double digits. And as we grow double digits, so do some of their incomes that are out there referring it. And that's a side hustle, a great aspect that you as a marketing partner get to take advantage of, all right? Jeff, I can just feel how meaningful it was for him to be matched to his friend in Connecticut, right? But he also gets to earn a little bit of money on that referral. So you have a happy customer, a happy member who is certainly pro-impact and because of the community, and is so thankful that Jeff referred that to him. And so guess what? That income continues to grow through those referrals. And that's exciting because you're doing it in a very pure way, right? You're doing it because you're adding value to people, not asking them to buy something. You're asking them, are you open to alternative ways to reduce the high cost of healthcare? And nearly every person in this country should be saying, yes, I am open to that. What do you have? And then that's where the opportunity of some of you that refer this, that are taking great advantage of, and you should, because that is the way we build this giant disruptive force of soldiers of an army for good. It's for good, and that should excite all of you. So enhancements are coming. I can tell you, we still the billing team's doing a great job. Oh, by the way, if you're asking about our repriced amounts, the providers accept our repriced rates 99% of the time. We only really 100% of the time they agree with our repricing efforts because it's based on fair market value. And if they don't agree it, we provide evidence, and then that usually solves a problem. Here's what's never happened with Impact, and here's what will never happen with Impact as long as I'm the CEO. We will never let a member, potential member or existing member that had a medical incident that was eligible to be shared by the community when they were a member, we will never let them get a summary judgment or anything issued against them. We may take a little longer to negotiate because that's what it takes for that 1% of the time. But at the end of the day, we are not going to abandon our member with a medical bill. We're not going to do what insurance has done, and that has unfortunately they have saddled nearly 100 million people in this country with some form of medical debt. The fact that now it's one of the largest reasons why families file for bankruptcy. We're not going to be that example. We have those results. They're in, and they're nowhere near acceptable. And that's why Impact Health Sharing exists, is to be that alternative, to be that force for good that is getting built. So I invite all of you to join our goodness, join our transparency, join our member-centric mission by helping advancing the great cause of Impact. Your friends will thank you, your family will thank you, and certainly all your teammates will be glad to partner with you in this worthwhile endeavor. So I just appreciate you allowing me to come on and talk a few minutes about where Impact is, where it was, and how it sits today, and then a little bit of what's coming in the really, really near future. And so, Jeff, Lauren, so excited to be with you. I'm able to answer a couple questions if we got a little time. So back to you, my friend.
No, Phil, thank you so much. And everybody can just feel Phil's heart as he's sharing about the goodness of what's happening through the Impact community. And for people that want to meet Phil, the Impact's exclusive marketing partner that many of us are referral partners with is actually doing their national convention in Cleveland, Ohio. Actually, literally in 3.5 weeks. Is going to be the weekend of June. What is it? The weekend of June 22nd, 23rd, and 24th. Phil's going to be there with Impact. This major industry first announcement that Phil's talking about. It's going to be officially announced there. It'll be incredible. So come out and meet Phil there. But I know that we've got many some questions that came into the chat that Melissa's going to, many of us, myself, Lauren, Melissa already answered for folks, but I know Melissa has a few that she wants to ask you that she thinks will be helpful for everybody. And just so grateful for your time today, Melissa, about Phil. So.
Well, I appreciate your guys' time. So one question that came from Dr. Kevin, actually, it was already mentioned, but I think it's great for a reassurance to everybody, is he mentioned about, what's considered a healthy health share organization with the money going in the pot, and if the well would ever run dry. So let us know what that's like for Impact.
Yeah, so, unfortunately, there are other good brother and sister organizations that are in the industry that are not healthy right now, that have a long backlog of bills. And, so you have that scenario. You have another couple that are in a prorate situation, right, where they say, okay, there's not enough shareable dollars this month to meet all the needs. So those that have that medical bill, let's say we can only meet 85% of it. Well, those that have it have to kick in the additional 15%. So that's going on, unfortunately, in the industry. Here's where Impact is, and here's what we were told that if you can get 3 to 4 months of reserves, distributed reserves that are in member-owned accounts. So that means if 100% of your members quit today, and you still have the same exact amount of medical bills coming in, if you have 3 to 4 months, then that's what would happen, right? You'd have 3 to 4 months to pay in those two scenarios, right? Those two scenarios likelihood are nearly impossible. But that was our goal with Impact, is to have 3 or 4 months. Now we're at, over 9 or, right around 9 months right now. So we're double what we should be. So as a not-for-profit, we say, do we actually need all of that money? And the answer is no, we don't. We will keep a cushion because there's obviously unforeseen things that come along. But so as a not-for-profit, we say, when we have that much money, what do we do to add value to the members? And so that's why we have these two program enhancements. Is we have some money that we want to invest in more services that will help you reduce costs, and in more ways that will help create and incentivize you as a member to create a healthier population, which ultimately on a long-term basis reduces costs. So that's kind of the answer around that. So we're just far exceeding the amount of reserves that are benchmark for a healthy healthcare sharing organization. So now what do we do with it? And the answer is, let's invest into the community.
All right. And just because I know we have several providers on today's Zoom call. So just going back to a question Dr. Kevin did have, he says we typically charge, I built out 250 to 300% Medicare rates to capture insurance plans. We typically charge a cash pay rate, which is significantly less already. Yeah. So if I have a patient who is cash pay, you would still try and negotiate further than my discounted rate. How would that go about?
No, if that cash pay rate has been accepted, then the member is submitting that bill, and we're honoring that what has been already negotiated between the member and the provider. We're not going to additionally bring that down. We're just going to accept that cash pay rate and process it accordingly, either towards the member responsibility, or if you've met that, then a check back to you.
Very good. And also one from Josh Casey, who has has served and just retired from the military, but he has a question on behalf of our military families. Any value of impact that has over TRICARE and the VA having a large network of military service of men and women, I would love to refer the service to. Do we have any value?
Yeah, so that's a great question. I don't know all the benefits of TRICARE. I'm not an expert on that. I would just encourage him to study, the offerings that we have and make sure they're comparable to TRICARE, right? Some of the benefits that, the enhanced services through the prescription, wholesale prescription program or the MD Live or some of these other new enhancements that'll be coming. But I'm not exactly sure on all the benefits of TRICARE.
Is there a maximum limit per individual or per household for a major health issue? I know the answer is in the guidelines, and I'll post that again, but if you could address that.
Yeah, so when we launched as a healthcare sharing organization, and many other good brother and sister organizations have this kind of annual limit. And so ours is not a household limit, ours is an individual limit. And we picked $500,000 as the annual limit. And here we are, over 115,000 medical bills, 4.5 years later. We have yet to have any individual reach that $500,000 limit. So we picked right in that regard. We're actually even studying right now, do we offer for someone that feels comfortable about maybe adding another $500,000, even though we historically haven't had it. And we've had, we have had a lot of cancer patients. We've had the NICU babies, that the premature that typically are the higher of all the medical events that occur. We've had multiple ones of those, and we still have yet anyone to reach the $500,000 limit. So I think that's the right number. But we're looking at ways right now where if you want to pay an additional X to get another $500,000, if that gives you comfort, then we may offer something like that, even though it hasn't been needed yet.
All right, now we know we have a lot of Californians on this Zoom call. California is a little special, so we just want to address this. Can California people be penalized if they use Impact instead of traditional health insurance?
So there is a form. I forget the actual the form number, but it's on the California website. I think Covered California is the web address. But there's a form on there where you print and you actually select the month you were a member of a healthcare sharing organization, and that gets filed along with your taxes. So you aren't, so that exempts you from the any kind of penalties associated with that.
Holistic doctors, considered covered with Impact.
So that we have an enhancement that's coming that we'll be talking about in just a few weeks, that we were very mindful of that medicine approach, right? And so they were part of how we architected this new enhancement, was that in mind, that functional, holistic approach, what you're going to be able to, instead of trying to get into and determine all the different ways, right, that are out there on what is medically sound or not, that was a daunting task. And so what we've come up with is a more generic way to honor that and honor your relationship with whoever you're getting that treatment from, for you to get some form of a credit on that. And we'll be talking more about that in the coming weeks. But they were very top of mind when we designed this program enhancement. So thank you for that. It's something we believe in, and we certainly see that increasing. And I think this is an appropriate, prudent phase one support of that medicine.
Very good. And do we have any update on Impact being available in New Jersey?
Do we ever? So we've put forth some legislation in New Jersey, working with our folks on the ground there. Monday, less than a week, June 3rd, we have a hearing in the Assembly on our legislation. The following Monday, June 10th, we have another hearing in the Senate on our legislation. Our hope is that legislation is voted and out of committee so that it can be voted on as an entire body and then sent to the governor, hopefully for signature. So in the coming week or two or three, we're really going to know, when we can start doing, when we can start offering impact in New Jersey. Of course, you can use as an impact member if you're from a neighboring state, right? And you need to see a provider in New Jersey. You can still do that. It's just offering it for sale. We have this little reference to an age-old 1999 reference from the Affordable Care Act that is really no longer relevant. And any new legislation in the last 4.5 years regarding healthcare sharing hasn't included any of that reference. I say all that to say we're trying to get New Jersey to up to speed so they can adopt what some of the newer states have done, and that's not preclude or penalize other newer organizations from offering a healthcare sharing plan in their state. So stay tuned. A lot going on right now in New Jersey.
Well, Phil, it's been such a pleasure having you on this call here today. And any final thoughts on your end as far as things that you want the community to know here, or just anything else that maybe we didn't go over today that you think of? We covered a lot of ground here today, but any other final thoughts here today?
No, I would just say this, that I'm thankful for all of you that see it like we see it, and that believe this is a meaningful alternative and how we practice healthcare sharing from a transparency, from a transparency point of view, and then also how you utilize impact at the provider. Know that yes. We have the same challenges that others do, and that's providers acceptance, because sometimes it's just easier to say, no, we don't accept that, than to do the work to accept that, right? And that's why we, as Jeff referenced, we spent the time and money to get registered in those clearinghouses. But when that happens, know this, we have a team that's they're ready to help you. We can enter in single case agreements. We have a dedicated credit card ready to facilitate payment. And then they should also know that, payment's coming on an agreed upon rate that more times than not, 99% of the community is accepting, and payment's coming within 30 days, which leads the industry. So we're built right. We think right. We're excited about how we're positioned, certainly excited about the advocates that you and Melissa and Lauren are creating to help us advance this cause, because we have deliberately chosen not to go out and spend millions and millions of dollars advertising the impact value proposition. We believe the best way is through person to person, a trusted friend telling somebody, are you open for alternative ways to reduce the high cost of healthcare? We know through this grassroots effort, community by community, state by state, that's how the change we seek will be implemented. So just proud to partner with all of you.
Well, Phil, we're proud to partner with you. So thank you for all that you do. And thanks for all that you do for all of us. We greatly appreciate your time here today. We know how valuable it is, and we do not take it lightly. So thanks for being with us today. For those of you that are attending here, we do this educational webinar every Tuesday at 12 o'clock East Coast time. So we'll be back next Tuesday. Feel free to come back next Tuesday and invite anybody else on the call that you want to hear the good news about about what impact in their community is doing for so many individuals, so many families, and so many small businesses. So God bless everybody. Thanks again for joining us today. Mr. Chrysler, thank you so much for your time. Lauren, Melissa, thanks for all your contributions, and have a wonderful rest of your day. God bless everybody.